I want to talk about authentic value being known in e-patient communities. In addition to working on patient empowerment, what I'm really interested in doing is using my business experience to alter the effectiveness of our healthcare delivery systems and our business organizations. This is a business talk. I'll talk about myself as a live specimen of an engaged patient, and you'll see where it goes. How I came to be here today. Well, first, my career's been in high-tech marketing. Second, I've been an online community leader, starting with CompuServe in 1989. I have some experience at how this all works. And I'm a data geek. I follow tech trends. I knew about disruptive innovation long before they wrote about it in healthcare, and I'm an automation geek. 2007, I beat cancer, and the following year, I looked at what I can do with my free replay in life, because I mean, seriously, the night that I got my diagnosis, I will never forget. I knew it was serious, but we didn't know what kind of cancer, and I remember at 1 a.m. waking up and thinking, this is it. You know, it was in January. I'm not going to see Christmas. I might not see summer. Imagine picturing your mother's face at your funeral. That's what hit me. Right? This is motivating. And when I got this free replay, I said, what am I going to do? And I decided to become a blogger. More about this in a moment. And then this year, I've gotten into participatory medicine and become a public speaker. I care about this stuff, and I know there are things we can do to change how well things work, and everybody can benefit. ePatients.net is the blog where a study group was doing this long before I came along. In the middle of the pictures at the top, you can see Susanna Fox's picture and lots of other people who've been doing this. They wrote this fabulous white paper that was published a couple of years ago, and John Sharp of Cleveland Clinic a few weeks ago, after he heard a talk at the Medicine 2.0 conference in Toronto, tweeted this: if you haven't read this white paper, you don't understand the future of medicine. So considering how far out on the frontiers they are at healthcare delivery, think about what this means. This year, that study group decided to form the Society for Participatory Medicine, and last week we launched a journal. This is a free, open access journal. You can go to jopm.org, read all the articles now. The first batch is a group of invited essays from thought leaders, and we are looking for articles for our big launch issue for starting in January. And the parameters of what we're looking for are on that website. Peer-reviewed for and by providers, patients, and everyone. I myself, quote unquote, just a patient, reviewed some of the articles in this issue. The leadership of the society and the journal are participatory, physicians and patients. My doctor and I are the co-chairs of the Society for Participatory Medicine. Health Leaders magazine in September, the cover story was the patient of the future. Guess who's there sitting in his den? I lost a lot of weight at the end of my cancer, but there's photographic evidence that that's over. And what they say on the cover here, this is important. These reporters, the woman who worked on this, nailed this so well. Physicians suggest, patients ignore. This is what we call compliance or adherence or whatever. Technology alone won't bring them together, but a new relationship might. And that's what we're talking about. Very good issue, very good article. Foundation principles for my talk. Patient is not a third-person word. Everybody says, yeah, well, we're all patients. Well, let me tell you, until your butt is on the line, or until you're standing there next to a hospital bed holding somebody's hand wondering, oh my God, what can we do? You don't know what a patient is for real. Your time will come. Patients of the future are connecting. That's what this conference is about. You got to get on the clue train. More about that in a moment. The old pathways are dying. New ones are growing. We've got to get with it. But this is not just a matter of whipping people to start tweeting. You'll see what I mean in a minute. Clue Train Manifesto, if you're not familiar with this document from 10 years ago, this book, it's now available. Full text is available free online. Martin Luther, when he attacked the Catholic Church, nailed 95 theses to the door of the cathedral. They wrote 95 theses, starting with markets are conversations. I've been in marketing for about 30 years. The conventional marketing funnel starts with a big thing at one end, eyeballs going in, and then you have people who become prospects and eventually die. And you work in marketing to adjust the ratios at each stage. Well, that's not how it goes anymore. These are some graphics I got from Forrester, and the Groundswell book that's in your bag has this one. The way it actually works now, is more like this. Eyeballs come in, and what those arrows around the corners signify is peer reviews, competitive alternatives, user-generated content, recommendations from friends. I know, as a marketing guy, you cannot control this. This is chaotic. This is no longer something where you can go in and tweak everything. So the question is, what are you going to do about this? Switching over now to a different dimension. This is something from the first issue of the Journal of Participatory Medicine. I got really interested when I got my diagnosis in knowing where is authoritative information. And when you find yourself in a crisis or somebody you care about is in a crisis, you're going to wonder about this because you'll see conflicting advice. So here's some radical quotes. After 30 years of practicing peer review, I'm unconvinced of its value. Evidence on the upside is sparse, evidence on the downside is abundant. Most of what appears in peer-reviewed journals is scientifically weak. Now, who is the left-wing hippie who says this? Richard Smith, the editor for 25 years of the British Medical Journal. That's sobering. Peter Frishoff, the founder of Medscape, commented in a sidebar on this article, better than anyone, Smith uses evidence and experience to demolish any confidence one might still have in traditional medical peer review. These are serious people from inside the industry, from inside the journal and scientific community saying this has not been working. What does he recommend? Reputation systems like Amazon and eBay. You've got to read this stuff. It's free. It's available, open access. These are not lengthy, burdensome articles. He says, I've reached the conclusion we might as well just put the stuff up there and let people comment. Now, isn't that amazing? That brings us smack into social media. I'm going to step over now to my particular case. I said, your time will come. Well, my time came. I had a sore shoulder. I went to the doctor. He said, get an x-ray. Those of you who know how to read x-rays may notice there's a shadow over there on the right side. What that turned out to be, I'll never forget this phone call. The guy said, your shoulder will be fine, but there's something in your lung. It was a golf ball-sized tumor of kidney cancer, we eventually figured out, that had spread all through my body. Is there anybody from Novartis here? No? That's too bad, because well, good. I love you. So this happens to be the graphic from the website of the treatment I got, high-dosage interleukin, and the numbered lesions there happened to exactly match mine. There was a big one in the thigh bone. My thigh bone eventually broke. I have a steel leg now. I had them throughout both legs. Even when the leg was breaking, I had to use a walker, but it had to be modified because I couldn't put weight on my forearm because that had a big metastasis in it. And a couple of weeks before my treatment started, I actually had one start growing out of my tongue. Yes, I had kidney cancer growing out of my tongue. I was a sick puppy. And this treatment worked. I'm extremely grateful. So what did I do? As Kevin said, I got online. This is my hospital's patient portal. I shared my password. Some people say, oh, you shared your password? Well, yeah, I was dying, right? And I shared my password with medically knowledgeable family and friends so they could explain things to me more. And I could have a sense of, not wondering what's going to happen next and just have a sense of being supported.